Good morning, everyone, and to those who may be watching on the live stream. I'm going to call to order the November meeting for the committee, the Health Committee for the County of Renfrew. With that, I wish to begin by acknowledging that as we gather this morning, I wish to acknowledge on behalf of committee and our community that we are meeting on the traditional territory of the Algonquin. We thank the Algonquin people and express our respect and support for their rich history, and we are extremely grateful for their many and continuing displays of friendship. We also thank all the generations of people who have taken care of this land for millennia. With that, Ms. Hill, has the roll been called?
Yes, Mr. Chair, the roll has been taken.
Thank you. I would invite now from the committee any disclosure of pecuniary interest, and if there are any, the general nature thereof, please. The chair recognizes none. We have 2 meetings in October. I would seek, are we doing this by means of a single resolution, Mr. Morrow, for each, or separating them and approving discreetly?
Thank you, Chair. My recommendation is that you separate them. Just in the event that there is a conversation or comment, then they can be separated out on either one, sir.
Thank you for your wisdom once again, Mr. Morrow. With that, I'd invite a resolution then to adopt the minutes of the committee meeting held October 13th, 2021. Moved by Councillor Love, seconded by Councillor Grills. Any question or comment? Seeing none, all in favor. That motion is carried. Thank you. Now, I would also seek a motion to approve the minutes of the meeting of the Health Committee held October 27th, 2021. Moved by Councillor Murphy, seconded by Councillor Bennett. Once again, any errors or omissions, committee? Seeing none, all in favor. Thank you. Those minutes are approved. There were no delegations at time of mailing. I have not been made aware of any, so I assume there are none. With that, then, I see Chief Nolan is with us this morning. I will yield the floor to you, Chief, for the Emergency Services Department report, please.
Great. Thank you, Mr. Chair, and through you to members of committee. We'll start with item number 1 on today's report, and that is related to community paramedics for long-term care. While you may recall, a year ago, we received funding to the tune of approximately $6 million for community, for $3 million, excuse me, for community paramedics to support people eligible for on the wait list for long-term care. There were a number of municipalities at the time of last year's announcements that did not receive any funding, and that was due to the fact that many of them did not have community paramedic programs that were being funded through their LIN at that time, some of which had chosen not to deliver any community paramedicine, which made them ineligible for previous rounds of funding. It was my privilege to bring it on behalf of the Eastern Ontario paramedic chiefs to the Eastern Ontario Wardens Caucus and raise the issue, as has been done previous times by municipalities through AMO and through a number of other forums. And it was a real privilege to be a part of the conversation with the wardens and the EOWC CAOs, and of course our warden as the chair, to fully explore and understand the issue of the disparities that were created with the lack of funding to the balance of municipalities, which totaled 34. And in doing so, the Eastern Ontario Wardens Caucus applied pressure on government and really raised for them their renewed sense of commitment to support community paramedicine and those on the wait list for long-term care in their communities. But I think most importantly, we're able to help the ministry come forward with an announcement that's in your package to include an additional 34 municipalities to a total funding amount in excess of $80 million, $82.5 million to be exact, in the expansion of that program. And that's for 2 years of program. Because we started last year, we had 3 years. So all the programs that now have funding will be reviewed at the same time period, approximately 2 years from now. And in doing so, we now have full community paramedic coverage in every municipality and First Nation that have paramedic services in Ontario. So very pleased with this announcement. incredibly heavy lifting on behalf of the EOWC and its members, from AMO right through to raising the issue. And our warden was able to pen a letter of thanks and acknowledgement on behalf of the EOWC for the commitment to move this important piece of work forward, Mr. Chair. So that is item number one. I'm sure the warden and or Paul will have comments when we come around to them in the questions for today's meeting. Item number two is related to the COVID-19 testing update. And when we look at where we're at in terms of demand, certainly there have been shifts with the resumption of school. There was an increase in swabbing significantly amongst pediatric population. And then we've also seen a bit of a shift because, as you recall, one of the main drivers this time last year that people had to get swabbed on a fairly routine basis to be able to enter long-term care and visit their loved ones. Now that children are being swabbed or are being identified as having symptoms that require a swab, we're seeing a bit of a change in the attitude or the tenor of people needing their swabs immediately the same day. Of course, they're trying to get back to work. They have kids at home. So there are different tensions within the system. We are exploring the point of care swab that does meet the PCR threshold. And we're in the process of doing that. One of the challenges of having one of those machines on site is every time you move it, it takes 24 to 48 hours to recalibrate. And of course, we're a mobile-based system. So we're going through that process now with both our medical and technical experts, trying to find a better way of delivering our model of swabbing throughout the county without necessarily having 5 or 7 units spread throughout the county. But that is one of the considerations that we're having, because we want to reduce that time to result as quickly as possible, but at the same time improve our throughput. And each of those machines take between 15 and 20 minutes to give you results. So if you're doing 4 swabs an hour, that's a very different experience than us being able to do a swab every minute and a half. So stay tuned in terms of how we manage that one going forward. In terms of the vaccine strategy, certainly now with the booster shots coming on board and the pediatric dosing coming on board, we're retooling once again with our partners across the health system and our CDHU to make sure that our communities and individuals have access to either the 3rd dose or in some cases their 1st dose of vaccine. So in doing that, we're looking at a multidisciplinary interprofessional teams that the paramedics are taking part in, and in some cases leading. The community paramedics are out in the community doing in-home vaccinations as well as part of their duties. And I think that that's important to remember those people that are shut-ins within the community and those that are frail and vulnerable, because we are bringing service to them, which really is an extraordinary effort. And I want to thank all the paramedics involved in that process. The item number 4 related to the palliative care model. The staff had gone through, and you'll see that there's a report here where we had one of our patients who was end of life and had a make a wish, if you will, a special request of something that the paramedic service had the capability of supporting. And in doing that, we acknowledge that paramedics are extremely busy to begin with, but there is not only a charitable, but also I think a humanistic component in terms of trying to bring a bit of joy to what is an otherwise difficult, in some cases desperate situation related to end of life. So I supported the paramedics volunteering on their own time and using the side-by-side to be able to make a wish, if you will, for one of the patients that we had within the program and their caregivers. And the staff felt it appropriate to bring forward this initiative, and there are pilot programs, Windsor and a number of others that are doing something similar. And remembering that these are extraordinary circumstances for the patient. One of the challenges, of course, is that we only have so many assets within the system, and certainly in conversation with the chair, it was brought up that we need to make sure that there's no impact of what is an otherwise excellent effort. We can't let that get in the way of serving the community from a 911 or response perspective. So there's certainly a sensitivity to that as part of this initiative. But I would like to thank Cody Copsel and Tyler Burgess, and there were other paramedics who also went their days off to be able to escort and support the family that's provided for you within the example that was provided. I don't expect this to be on the regular experience, but it is something that we're doing, and I think it's an important community gesture and something that obviously will leave a mark for that individual, but also for their families in a positive way. So that initiative is going on, and what we're looking at is to review that on an ongoing basis and then bring further information in the new year should there be any more rigor or application provided related to the program. As well, we had Bruce McIntyre from the Eagle Leader participate with home visits, and of course we had consent from those people that were involved, but Bruce wanted to get a true sense of what's going on in terms of the paramedics and their role within the community, and there will be a significant article about this program and its impact on the community, and hopefully some patient stories, again, with their consent, in terms of the programs that you're supporting. And I think it's really important that we get the message out and that we truly understand what that impact is to the people that we're serving. So we're trying to promote, but also give clear eyes to the people who are writing about the program so that they can accurately and fairly reflect the work and the effort that's going in from council to staff right through to the front line and its impact on caregivers and our patients. Item number 5 related to the 2021 Ontario College of Family Physicians Early Years Award. Congratulations to Richard Johnson, who was nominated for the 2021 Ontario College of Family Physicians Early Years Award. So a big kudos to one of our own, in Richard Johnson, and there's a letter that's attached for your information within today's report. Item number 6 related to paramedic relay. Again, and I don't mean to overstate in any way, but this has been an exceptionally difficult time over the past 2 years for all of us. And you can imagine for paramedics and first responders how difficult it's also been, knowing that there's considerable uncertainty in terms of every day they go to work and the challenges associated with just operating within the environment of COVID. So Sierra Stinson, who's doing our communications work within the department, undertook an effort with some of the staff to be able to support an event for staff in a paramedic relay. So we had OPP, firefighters, dispatchers, emergency department staff come out and participate in an outdoor event that was socially distanced, of course, and there was lunch donated by Bonashire Bakery and Bistro, as well as No Frills of Renfrew. Again, a volunteer effort, but something where we're just trying to instill a little bit more joy and a little bit more happiness, frankly, into what has been a difficult time. And I think one of the good outcomes of this is that $567 was collected and will be donated to Hospice Renfrew. So just a different way of giving back to the community in a way that we're trying to build a little bit of camaraderie and certainly a sense of togetherness as we move forward through COVID and hopefully out the other end, but in a way where we've been able to come closer together and not be pushed further apart in that effort. Item number 7, Mr. Chair, usually we leave that for last in terms of a little bit of a roundup at the end of the meeting. So if you'd like, I can, or at the end of my talk, I'm happy to skip that and jump into bylaws if you wish.
Actually, I'm just thinking perhaps Chief will kind of conclude the information items at that point, review them for any comment, and come back to the Treasurer's report prior to going into the bylaws, and we'll address the bylaws at that point.
Great. So I'll leave bylaws for now, or do you want me to speak to this intermunicipal billing?
No, I think that we'll come back to that after reviewing. We will address the bylaw on its own merits following the review of the information items. Just prior to going back to item number 1, was there anything within the Treasurer's report that you wish to highlight or underscore?
Thank you, Mr. Chair. That's clear. I would say that in terms of where we're at from a budget variance, and you pointed it out, it's nice to see some parentheses every once in a while within our budgets. But that being said, we know that this is the September 2021 report. So, there are definitely, pressures, especially related to our participation in vaccination. And as we know, the province has made motions and has come good in some cases being able to cover off additional expenses. So, you know, everything that we're doing from a vaccination to a swabbing, community paramedicine and regular 911 still is not business as usual. So there are, you know, risks associated with those activities and that involvement. However, you know, I can say from a line-by-line perspective, I will be meeting with Mr. Foss and his team, I believe on Monday of next week, and building up our budget going into next year. And that will also be an opportunity to understand sort of the rhythm of some of the new funding that we've received. And you'll see that within the community paramedic component to the budget, where there will be a reassortment of expenses being broken out within the individual programs. The province just recently came out with high intensity support funding, for example. So it is constantly a work in progress. You know, a big thank you to Jeff and his team for leading us, keeping up with us, sort of moving with us as the province is making its different motions as the year goes on. But I can say that overall, we're in a pretty good place right now. However, individual budget lines and individual pressures will continue to evolve. And that just happens to be the nature of the time that we're living in. There is some very good news in that as well, in that we've been working with the Ministry of Long-Term Care because, as you know, the provincial funding year is March 31st, April 1st. And the rules associated with having product in hand by a certain deadline and so on and so on. We've been working well with them in terms of being able to acknowledge that if a purchase had been committed prior to March 31st, that with delays in shipping and delays in availability, as long as the purchase was made, or the commitment to purchase was made prior to March 31st, that they will honor that and we can expend those funds, especially related to the $1 million that we had to 6 months or less to spend in the previous year related to the long-term care announcement. So it is a movable feast within the department. But when we look at the overall situation come September, we're in good shape. And there have been some cautions about spending around VTAC and around vaccination and so on. And we'll continue to keep a close eye on that and shoot for coming in balanced by the end of the year.
All right, thank you very much, Chief Nolan. We will pause there, and committee, I will go back and we will review the information items in order. I would seek any question, comment, discussion on item 1, the community paramedics for long-term care. Warden Robinson, I thought perhaps you might.
Well, thank you very much, Chair, for the opportunity. I just wanted to say, you know, as far as the East Ontario Wardens Caucus is concerned, it's very easy to advocate for something when you receive a report, especially from your chiefs of paramedic service, that is so fulsome. There was no blanks, no questions. It was excellent. You know, certainly our Chief Nolan, we all know, is an incredible presenter. It's the second time, I think, maybe the third time since I've been warden that Chief Nolan made a presentation to the Eastern Ontario Wardens Caucus. The initial one was around VTAC. You know, healthcare transformation, public health, long-term care, paramedic service, and VTAC have all come to the East Ontario Wardens Caucus table in the last year and a half. And, you know, there's a reputation that the East Ontario Wardens Caucus has, and that is that we don't just point out the problems, but we provide some solutions. And I think that the timing is everything. And it was a perfect time for the chiefs to present to the East Ontario Wardens Caucus to move that forward. No one can argue that the people who are waiting for long-term care deserve to be cared for during that wait period. And now that is across Ontario, I think it's absolutely fantastic. Again, all of our paramedic chiefs need to take credit for that. And certainly Chief Nolan led the way. So again, it certainly made my job very easy.
Thank you very much, Warden Robinson. Any further question or comment? Thank you. Moving on, item number 2, the COVID testing update. I have a single comment. It is certainly endemic within this country also with respect to our national pastime, hockey. Always keep your eye on the puck, never take your eye off the puck. And this is, I think, demonstrative of perhaps taking eye off the puck. Just before coming to order this morning, I looked up the numbers. I think we bottomed at 348 on a 7-day rolling average about 10 days ago. We're now approaching 470, I think. I think we, by times, can perhaps deceive ourselves into thinking that we are normal while it is still on the horizon. So I think this testing is certainly indicative of that. The second, perhaps most potent aspect of COVID is sneaking up and making you look foolish. So certainly commend the paramedic service for being as nimble, as flexible to be ready regardless of the situation. Item number 3, Councillor Emo.
Thank you, Chair. Through you to Chief Nolan. I'm curious about the second paragraph in point 2, where you talk about being held in conjunction with the Ontario Health Team. I'm just curious, as I didn't understand, or maybe I misunderstood. I wasn't sure they were an entity yet. So if you could just sort of give us a little explanation on that, please.
Yeah, I think good. Thank you, Councillor, and through you, Chair. I think what's being referred to there is around that multidisciplinary interprofessional approach. And I don't think it's the health team as a formalized organization so much as the health team that exists within the Deep River area and trying to take that approach. So probably a misuse of a title versus a term. But what I can say is, this has really reshaped our relationship with allied health providers. We have paramedics working with administrative staff, never happened before. Paramedics, public health staff working shoulder to shoulder. So there's a melting pot approach, which I think probably exemplifies where we're trying to go with some of the Ontario Health Team activities, but you're right to point out that it is not the Ontario Health Team that should be capitalized. I'd say it should be a health team that should be in lowercase as a team-based approach.
Thank you. As we struggle to understand and the role of the Ontario Health Team in our community, I was just curious. So thank you. That is helpful.
Thank you, Councillor Emo. And yeah, on a going forward basis, certainly I think that what the chief is referring to is certainly a precursor towards where the target or trajectory, if you will, of the Ontario Health Team. But I think precision of language moving forward, would just be careful on confusing that issue. Anything further on item number 2? Item 3, the vaccine update. Item 4, the community paramedic program. Warden Robinson, please.
Thank you very much, Chair. It was really nice to read this, and it did bring some tears to my eyes. I'll admit that right up front. Chief Nolan talked about bringing joy to the patient or the individual that you're supporting through palliative care. I think you also brought joy to your staff, and I think that's very, very important. As we all know, working in the healthcare system, there's some highs, but there's a lot of lows too. And certainly, choosing to work in a palliative care team setting, being able to bring smiles and joy are essential. I have no concern that you would allow this to interfere with the daily operations of our paramedic service. I think it's an add-on and a very valuable one. And I would suggest that our community paramedics are in a position where they can hear the wishes and the hopes and the dreams of people, even though they know that they are palliative. And if we can't help them, I suspect that our community paramedics can reach out to other people or other organizations in the community to try to facilitate whatever the individual is looking for. Because in my opinion, palliative care is not just about taking care of the body, it's taking care of the mind, the spirit, and the soul. And I think your staff are doing an excellent job. So thank you very much.
Thank you, Warden Robinson. Any further on item 4? Councillor Emo.
Yes, I agree wholeheartedly with what the warden has said, and might suggest it it may be time for the County of Renfrew to look at establishing a foundation, a community foundation, to be supportive of community paramedicine and other initiatives that contribute to the quality of life for our residents. And you know, I think we've kicked it around in my time here since 2006 a couple of times, but it may be a longer range project to take a look at putting something like this together, because as we become more advanced in our care of our residents and staying at home and being able to pass at home with dignity, this may be a logical next step for us. So thank you.
Thank you, Councillor Emo. Anything further? Certainly commend in this instance, Chief, you had certainly within the report and in your call out, the paramedics Kopsel and Burgess. As the warden has said, there are two components, of course, to palliation. Palliative essentially is that there is no therapy that is going to bring about a remedy, and that is certainly distinct from end of life. But certainly in that palliative sector of healthcare in particular, it is a particular challenge. So I think, as the warden has said, both for those that are on that particular journey, but those that are also assisting them along the way, that I think this serves both of those. So I think that this shows a true commitment by the paramedics in terms of volunteering their own time. I think that that is simply outstanding to recognize the needs of this community. But certainly on a larger, perhaps overview, as the warden had said with respect to item number 1, as I think that perhaps I will bring forward when we're reviewing the Treasurer's report, the innovation that has been demonstrated across the paramedic service in being able to deliver palliative assistance to remain in the home, the opportunity to provide long-term care in the home. These things, the common denominator is the home. That is a substantial change that unto itself, in terms of both long-term care at home and palliative care at home, of continuing to meet the needs of our community where they live. So I think that is an enormous change over the course of the last 10 years as well, and must be commended even as much for that. So thank you, and thank you for this effort above and beyond. With that, going on to item 5, the 2021 Ontario College of Family Physicians Award. Warden Robinson.
Thank you, Chair. I've had the pleasure of working with Dr. Richard Johnson for the past 3 years. He's young, he's energetic, and he's one of the movers and shakers when it comes to creating the Ontario Health Team in our area. So I would certainly be very pleased if someone made a motion that the warden send a letter of congratulations to Dr. Johnson.
Sorry, I'm waiting for my mouse. Thank you. I believe that Councillor Love is prepared to make such a motion, seconded by Councillor Murphy. Both of their hands were in the air. I assume that is what they are doing. Mr. Morrow, did you actually, I guess, Ms. Hill, were you able to get the warden's wording for such a resolution?
I was.
Yes, I have it.
Oh, good. And that was
Okay.
Wendy, what you had was direction from committee to the warden to prepare the letter?
Yes.
Thank you.
Okay, thank you. With that then, any further question or comment on the motion before us? All in favor? That is carried. Thank you. A capital idea, Warden Robinson, to direct yourself. Anything further on item 5? Item 6, the paramedic relay. Once again, Chief Nolan, and forgive me, you certainly had identified the paramedic that seemed to have been the driving force behind this. It's not in the report, but certainly through you will extend to her enormous thanks for this. Certainly, committee, we are going to be seeing also an item with respect to the long-term care report. both the paramedic service and long-term care are at the front lines of healthcare with respect to COVID-19. And I think as we are, I'm not sure what we are now, 19, 20 months perhaps into COVID-19, that we all feel it, but that there is a whole different layer to those public-facing healthcare sectors. So enormous kudos to your staff for identifying these things that can continue to provide some of that support to your sector. Warden Robinson, you also had a comment.
I do have a comment. I just want to thank Chief Nolan and his staff for not asking any of County Council to participate in the 10 or 5-kilometer walk run race. Thank you for not doing that.
You're welcome.
It was on the books, as I'm made aware. We just couldn't keep that 2-meter distancing, so son of a gun. Anyway, anything further on the paramedic relay?
Chair, I believe Councillor Murphy has her hand up, sir.
Oh, sure enough, Councillor Murphy, please.
Thank you, Mr. Chair, and I concur with the warden. Thanks for not including us. But was there like a lot of smack talk? Was it like, I think that you could get almost everybody involved if there was a little something to win at the end, you know, sort of like a golf tournament where Bob Sweet tries to take down other people. Just saying.
Thank you, Councillor. Thank you, Councillor Murphy. I think we can probably take that under advisement, Chief Nolan.
Well, being a respectful workplace, of course, there was no smack talk, but you know, egos are easily bruised when people are faster or slower than others. So, especially when it comes to our uniformed and healthcare partners. So, I'm sure there was ample discussion at the event, and I think, most importantly, I think everybody had a sense of purpose, because you know, raising almost $600 for hospice for among 40 people is a great accomplishment, and just to get 40 people out to do anything outdoors right now is significant. And Sierra, you may recall Carolyn McGrath, before she went on maternity leave, did all of our communications through the emergency management lens for COVID, and worked closely with Mike Barber. Sierra Stinson, not a paramedic, but a communication specialist, is performing those functions within the department now, and I believe also assisting Paul with some corporate communication. So that role has really helped us try and understand and tackle some of the cultural opportunities within the department, and make sure that everybody's been on the same page in such a difficult time to be able to navigate. You can only imagine, even, you know, vaccination policy and what does it mean to the individual, to am I allowed in the hospital if I'm not double vaccinated as a paramedic? So it's a critically important role, but you know, to your point, I would say that it really brought out a special joie de vivre, if you will, amongst everybody that participated, and hopefully that's something, the smiles that we can continue to nurture as we go into winter.
Thank you, Chief Nolan. Anything further on item 6? I see none. Moving on to item 7, then, the Treasurer's report. Any question, comment? As the chief certainly recognized in his review, quite pleased. This is 2 months running now, or rather 2 reports running, with respect to seeing a parenthetical number on the right-hand column. It's not something that we had become accustomed to, and I know that it is certainly subject to variation. But pleased nonetheless at this point to see that. The comment that I wish to make, though, is that second section. I think that second section perhaps only came into being within the last 3 or 4 years, and it is growing longer almost by the year. That is paramedic other. And that was what I was referring to earlier, is we are at the intersection of innovation and need, and recognizing that this is something that we have long needed in our community. And we are finally now having an opportunity to demonstrate both the validity of the concept, but also as part of the person-centered, patient-centered care. I can think of nothing more that is meeting the need. So of course, presupposing my colleague from Deep River, very pleased as well that this is provincial funding, continuing to recognize the limited role that municipalities have in the provision of healthcare, but enormously pleased and would certainly like nothing better than to even see that particular section in this financial report grow and meeting more of the needs of our community. Once again, then, committee, anything further on the Treasurer's report? I see none. Chief Nolan, take us through the intermunicipal billing, please.
Thank you, Mr. Chair. So within bylaws number 8, we have an intermunicipal billing section, and Paul may be able to help fill in some of the context. But since 2015, there have not been intermunicipal agreements between ourselves and the other neighboring municipalities. For those of you that were around in those days, this was a highly contentious issue with the City of Ottawa, and litigious issue. And at the end of the day, the province had taken away the mandatory requirement for an intermunicipal agreement between municipalities, which left us in the lurch at the time. A number of the different activities that we undertook to mitigate the cost and the risk associated with losing our paramedics to another community have really, I think, shown benefit in that the goal has always been to serve our own communities first. And I can say currently under the leadership of Chief Poirier, a new paramedic chief in Ottawa, there's certainly been an understanding in terms of the challenges that occur as a result of one municipality mandating resource from another municipality to respond to them. That being said, today's recommendation is related to our relationship between ourselves and Lanark County. And an example of that would be the ski hill at Pakenham. If Lanark's resources are depleted and somebody's on the hill with a fractured femur, for example, Lanark, through the dispatch system, would identify that we're the closest, most available unit. They would ask us to go there. That becomes a tick mark in our column to say, as per the agreement, we've done one for you, you've done none for us. A reconciliation needs to happen at the end of the year when all the ticks align in the process, so that one municipality is not taking advantage of another, and there's also an acknowledgement financially that we're happy to support one another, but that it needs to be on an exception basis, not on an expectation basis. So Paul and his peers raised this issue. There are intermunicipal agreements between other municipalities within the EOWC, I believe, Paul. So really, we're following suit in terms of, as a matter of good faith, going back to the principle of let's keep track of what we're doing for one another, and if there's a discrepancy at the end of the year, that we'll balance that out based upon the funding amounts that are within the agreement within the packet. It does not amount to a significant amount of money, knowing that we've been able to realign our dispatch protocols, our utilization of one another, and I would say that the biggest sort of outlier, if you will, are just geographic relationships to your neighboring municipality. So for example, Arnprior is immediately on the doorstep of the City of Ottawa. Arnprior happens to also be very close to the doorstep of Lanark County, and it would only make sense that if you are on the bar line or you are, very close to Arnprior and you are having a life-threatening emergency, that the Renfrew paramedic service through the Arnprior base would service that, and vice versa. We certainly do call Lanark in to assist us, principally in the Arnprior, occasionally also up into the Highlands. There are also occasions into Calabogie because Lanark does have availability of an emergency response vehicle at the village of Lanark, so it might shoot across to Calabogie, for example. So it's I think a good first step in terms of the partnership and the spirit of cooperation that's happening at the EOWC under the warden and Paul's leadership, and I put before you an agreement that has been agreed to in principle, pending approvals, between CAOs and between paramedic chiefs. So we think it's fair, it's reasonable, and it's contemporary in terms of its view of inter-municipal billing.
Thank you, Chief Nolan. With that, committee, I'm going to read the recommendation and then seek a motion that the Health Committee recommend that a bylaw be passed to authorize the warden and CAO to sign the 2020 Inter-Municipal Billing Agreement between the County of Renfrew and County of Lanark for provision and cost recovery of paramedic response through the Ministry of Health Seamless Service Delivery legislation at the next session of County Council. Can I have a mover, please? Warden Robinson, seconded by Councillor Emo. Any question, comment, discussion? Councillor Emo.
Thank you. Glad to see this. Glad to see it's 10 years. That shows good forethought. And then there's the automatic increase that stays with inflation, if you will. Curious if we were to sign one with Ottawa or with Hastings or Lennox and Addington or even I guess the Perry Sound District Services Board, would the rates be different when I look at point to point 3, the recovery rates? So would each of the rates be different for adjoining municipalities? I'm just sort of curious about the math there and the rationale. Thanks.
Chief Nolan.
Sure. I think I see Paul motioning on this one, but I think from my perspective, what we've done is take an activity-based costing amount from each of the services. So I would expect that yes, there would be some variability between those. Previous agreements kind of had a flat rate amount, which wasn't necessarily as accurate. It could have been. I think this is a fair reflection in terms of the cost per call after the 50/50 rate adjustments and so on, taking out other activities such as community paramedicine and so on. So yes, I would expect there to be some variability, but $10 one way or the other, I think, is probably what I would expect at the most.
I will recognize Mr. Morrow. As I read this, I'm certainly subject to confirmation. It seemed to me that there is and I think Chief Nolan, you were speaking to that, there is a netting out of this on an annual basis, i.e. if there is essentially been as many hours spent interchangeably, it is a wash. But ultimately that the rates that are contained herein would be where there has been an imbalance in the hours of service, at which point then there is recognition of whatever the cost is within that municipality's cost structure. Mr. Morrow.
Thank you, Chair, and through you to committee. I'm not sure we would get this with the City of Ottawa, and I'm not sure we want it with the City of Ottawa at this point. And as Chief Nolan has alluded to, that was the source of the issue some time ago in dealing with the City of Ottawa. Part of the impetus for this particular agreement stems from the County of Lanark's audit, where their auditors had come in and recognized that they had agreements with some of their other neighbors. As the chief has indicated, and I believe, Chair, as you've suggested, the costs are minimal because it is a wash and there is a netting out at the end of the year. Their auditor had suggested that they have the agreement with the County of Renfrew just to better track costs and who's responsible for us. But in my conversations earlier on with Mr. Foss on this particular item, it goes back and forth from year to year. And for the most part, over a 5-year period would typically net out to zero anyways for us. So, 1 year was $12,000, and then 1 year was $7,000 or $8,000 for us. So it was back and forth on that. So it was more a function of making sure that there was a control in place from the perspective of their auditors to understand that the County of Lanark had an agreement. So again, this is something that we were reluctant to do in the past, given the situation with the City of Ottawa. But based on our conversation with the CAOs from the EOWC, there is a number of us wanting to try this approach. Thank you for that, Chair.
Thank you, Mr. Morrow. Anything further, committee, on item 8? I'm just going to weigh in briefly. I'm not sure 4 or 5 years ago the Ambulance Act was actually changed. This was part. This reconciliation was part of the seamless service delivery, and it should be made clear absolutely that is appropriate. The province is funding half, or in the provinces, mathematics, 48 percentile or 52%, that's 50-50 as far as the province is concerned. But ultimately, as a funder of the paramedic service, certainly must recognize the principle of seamless service delivery. Unfortunately, when that mandated reconciliation was removed from the Ambulance Act, those situations have arisen now where perhaps it is a structural issue where services are being provided and received as opposed to seamless delivery, which was the intent behind this program. And ultimately, that is what has led to some of the disparity, the irritation, perhaps. And I think that this is a template, at the very least, if not particular as we might move forward with our larger neighbor, the city of Ottawa. Perhaps it is at least identifying that this is appropriate and then should be followed. Anything further? All in favor? That is carried. Thank you. I think at this point, this is where I normally make my my singular error. Can I have a motion to accept the report, the emergency services report as a whole, please? Councillor Murphy, seconded by Councillor Love. Once more, a final opportunity. Any further question or discussion? All in favor? That is carried. Thank you. With that, we're not doing too badly, actually. Is everyone still okay to continue? Let's see that thumb. Okay. With that, thank you very much, Chief Nolan. I will yield the floor to our other Michael. Mr. Blackmore, please, if you could take us through the long-term care report.
Good morning, and thank you, Chair Donahue. Good morning to committee members. Through the chair to committee members, the long-term care report starts on page 19 of your package. Items number 1 and 2 are the Bonnechere Manor and Miramishi Lodge residence statistics up to October 2021. And if you could please keep in mind that the percentages are inclusive of 6 beds purposely kept vacant to allow for an adequate number of isolation beds should the need arise. Item number 3 identifies the wait list for the County of Renfrew long-term care homes, current as of September. And at a glance, figures have been fairly static over the past 3 months. Item number 4 is the COVID-19 pandemic update. In keeping with strategic goal number 3, it illustrates the current COVID-19 vaccination rates for residents, staff, and essential caregivers for both homes. And committee will recall that a notice has gone out to staff identifying essentially that those choosing not to be vaccinated will be placed on an unpaid leave of absence commencing November 15th. And obviously that's this coming Monday. And regrettably, despite attempts to educate regarding vaccine safety and the importance of vaccination for the safety of our residents and staff, at present, I know in the report it indicates 14 staff at the lodge, but we've actually dropped to 13 and 6 at the manor refusing to be vaccinated. And this represents a cross-section of frontline staff ranging different departments. And as is the case, long-term care advocacy groups and other community health agencies continue to rally the government to enforce a provincial vaccine mandate, which is yet to be the case. Well, actually, the provincial government has identified to this point that they have no intention of doing so. Item number 5 is the Fixing Long-Term Care Act 2021. So it's a fairly significant endeavor in that it expands upon the recently announced revisions to the Long-Term Care Act 2007. It's newly tabled as the Fixing Long-Term Care Act, and it espouses to improve long-term care on the underpinnings of 3 key pillars, that being number 1, staffing and care, number 2, accountability, enforcement, and transparency. And number 3, I cut off. I'm sorry. Safe, modern, comfortable homes for seniors. And some of the more significant revisions include the inclusion of the 2025 goal for all homes to achieve 4 hours of resident care per day as well as the incremental milestones to achieve to get there. Includes revising the Resident Bill of Rights to more closely align with the Ontario Human Rights Code, and enhanced compliance and enforcement, including the doubling of fines and potential criminal prosecution. The bill also allows for inspectors to issue compliance actions, and previously this was something that was only afforded at the director level. In addition, the bill allows the ministry to take over direct supervision of a home without revoking the home's license or closing the home down. And just, I mean, sector advocates indicate essentially a lot of the things that are in place, proposed to be in place in the new act, have largely existed in the previous act, and including the ability to lay fines and for which over the course of the 2007 Long-Term Care Homes Act, none have been levied. So, I mean, it did exist as an option to do so, but the new act basically affords the ability to double those fines. Item number 6 is the Ministry of Long-Term Care new inspections program. So it overviews recent revisions to the Ministry of Long-Term Care inspection program, and specifically that there's a significant increase in number of inspectors coming our way, essentially a doubling, such that there'll be enough. Well, there'll be one inspector for every 2 homes when all is said and done. Is the goal. In step with increasing inspection frequency, the ministry is also introducing a new kind of inspection. Essentially, it's what they call a proactive inspection. That's a bit of a variance from what's been typical. I mean, the ministry went out of their way to identify that their former compliance advisors were no longer advisors, they were inspectors. And this proactive approach kind of goes back a little bit more to the advisor approach, in that on these proactive inspections, the inspectors will take the opportunity to identify weaknesses, areas to be improved upon, basically more of an assistance to the homes than an enforcement. So the idea is that these will get underway. Actually, they're underway right now. I think the province has a goal of achieving 10% of these proactive type inspections in the very near future. So that will be interesting to see how this all unfolds. Item number 7 is a PSW wage enhancement. It provides notice essentially that the $3 enhancement will continue to March 31, 2022. And there's been talk as to whether this is going to be made permanent. And thus far, the response from the province has been that it's basically a wait and see. There's been no commitment to permanent at this point. Item number 8 is the investments to increase direct care time for residents and the supporting professional growth fund. So both homes have received their official allocations for the period November 1 to March 31, 2022. For the RN, RPN, PSW staffing supplement, the manor will receive $539,540. The lodge, $497,575. And they've also indicated in that form of a table the funding received over the following 3 years, ending in 2025. And those are represented as ranges because there are a number of variable factors that to be taken into consideration, including budgetary approval, occupancy rates, the effect of new beds coming online throughout the province, and the staffing data results, just how close they actually are to being at that 4 hours of resident per day for care. In addition, the funding allocations for allied health for both homes announced for the same period, with the Bonshire Manor to receive $101,645 and the lodge to receive $93,740. And again, tables presented identifying potential funds to be released up until 2025 in the same fashion as the staffing announcement, identifying basically the same variable factors to take into consideration as to why it's been introduced as a range versus an actual number. Item number 9 is Free Training Skills Advance Ontario. So this is a fund that's coordinated by way of the Eastern Ontario College Consortium. It's designed to promote workforce development. Algonquin College is a member, and they're positioned to offer training to both the long-term care homes facilitating a variety of course and content options. And at present, we're looking at working with the college to coordinate our what's called gentle persuasive approach training for our staff. Essentially what it is, it's a means to enhance skills, soft skills for staff to better engage residents who may be exhibiting responsive behaviors. It's a 4-hour course. And we're hoping to double up with, well, the funding to provide the courses through the Skills Advance program. But in addition to that, the province had announced funding through the Support Professional Growth Fund, and that should assist with covering backfill costs, i.e. the costs, the hourly wage to attend such training. So we're currently working on that with Algonquin College for Growth Homes. Item number 10 summarizes the 3 additional training programs available to nursing staff throughout Ontario. The first being the BEGIN initiatives, BEGIN being Bridging Educational Grant in Ontario. Provides tuition support to PSWs seeking to bridge to RPN, and similarly RPNs looking to bridge to the RPN position. The second being the nursing program transformation in Ontario colleges. It talks about efforts underway to achieve an additional 500 enrollments in bridging programs and the financial supports to go with that to enable foreign trained nurses to be eligible for registration. I mean, these are all going to be very key aspects with regard to getting homes to that 4 hours of resident care per day, because those are very significant increases in full-time equivalents to it, be able to achieve that number. The third is the Learning Interprofessionally Healthcare Accelerator, and it's a virtual platform designed to assist with PSW training. So both as within the college scenario and also within the home scenario, to be able to provide virtual ongoing training and support. Item number 11 is the September's Treasurer's Report attached as Appendix LTC 1. And it starts on page 30 of the report. And I mean, I think we touched on this at a previous health committee, but committee may notice that there's a significant overage on the variance for both homes within the general and administrative salary lines. And this is primarily the result of unbudgeted COVID-19 screeners and screener coordinators. So this is where these positions are being paid out of. And so it's not reflected in the budget, but we do receive funding to cover those costs through the COVID containment fund. Item number 12 is the Ministry of Long-Term Care Inspection Report. Ms. Jillian Chamberlain, Inspector with the Ministry of Long-Term Care, conducted a critical incident summary system inspection at the Lodge on October 1, 4, 7, 8, 12, and 13 of this 2021 regarding 2 critical incidents. Non-compliance findings were issued, including 3 written notifications with 2 voluntary plans of correction. So just for reference, written notification is basically the first level of non-compliance, and the voluntary plan of correction is something that basically can be tacked onto a written notification. So the voluntary plans of correction are coinciding with 2 of the written notifications, not that they're not separate incidences. So this was with regard to resident hand hygiene and adherence to the wound care program, home wound care program. So voluntary plans of correction have been completed, inclusive of education for staff, and the full report is available on the Ministry of Long-Term Care website, and the link is provided. Item number 13 on page 27 of the report is the Bonnechere Manor Seniors Adult Day Program Surplus Reallocation. So as committee is aware, the Bonnechere Manor Adult Program has been operating virtually since late August this year due to the pandemic. This has resulted in a significant surplus in funding. And it's basically it's provided an opportunity to reapply this funding at $99,041 for things such as repairs and upgrades to the Renfrew location, including ceiling tracks and motors, for mechanical transfer of non-weight bearing clients, a mechanical bed for a quiet rest area, updates to the garden. It's extending the outdoor programming season and installation of rubber material over concrete areas to reduce risk of injury. An adult easy lift change table for the washroom, wireless audio system for clients with decreased hearing, and a padded bench foot lockers for clients to store their winter attire. A decision on the submission is anticipated by January 2022, and committee will be kept apprised of this request. And again, just reminding committee that this funding is 100% funded from the ministry. Item number 14 is the Miramishi Lodge Meals on Wheels Administration Clerk position, consistent with strategic plan goal number 2. And committee may recall that the Miramishi Lodge Meals on Wheels program was paused at the beginning of COVID-19 pandemic. It was basically, that was the point where it just became evident that it couldn't continue. But even prior to that, we were encountering significant challenges with regard to maintaining our delivery driver services. We did undertake a survey of former clients with regard to whether alternate arrangements that were put forth through the Care for Frozen Meal program were meeting expectations or needs, and for the most part found that to be the case. And there's been some conversation about this closing of the program, obviously. So going back to the January 2021 Health Committee, it was proposed that the termination of the Meals on Wheels program would see the supporting administration clerk position reduced from a full-time position to a part-time position. So just a little bit of a background on this position. So back in 2014, the Meals on Wheels data entry clerk was amalgamated to be with the accounting clerk number 1. With the title change, it became the administration clerk. And this position has evolved significantly to one that is critical to achieve the minimal level of administrative function required to ensure the base level of support for staff and residents. So this is pre-COVID. We relied heavily upon this admin person to assist with a variety of administrative functions, including interacting with family and residents with regard to their savings accounts, funding, billing, things like this. And at the onset of the COVID-19, just made that position all the more valuable. It took on the role of assisting with maintaining vaccination status, covering for screeners, engaging family at when they come in, just a whole host of other activities. So this position is currently contained with the Miramishi Lodge budget until December 31, 2021 in a full-time capacity. And we're seeking to maintain this position as full-time in order to achieve the necessary admin support to family and staff described. And just for purposes of illustration, in doing so, this would be Miramishi Lodge would maintain 5 FTE of 5 full-time equivalents of admin support, and approaching parity with the 6.5 currently in place at Bonnechere Manor. It's our intent to include this position in the 2022 budget at full time. Item number 15 is the long-term care homes health human resources status. And if I could, as committee is aware, the impact of the COVID-19 pandemic on staff has been unprecedented with regard to challenges to our health human resources for both union and non-unionized staff. As the administrator of a home, having endured the COVID-19 outbreak, and more recently as director of long-term care, leading both county homes through this continuing pandemic, I seek committee's indulgence in providing a depiction of the evolving health human resources challenges endured at both homes. As has become more commonly experienced among long-term care homes over the course of this pandemic, both homes are routinely challenged with staffing shortages among frontline staff. And without question, when we're down any 1 or 2 or 3 on a given unit, it impacts negatively on quality of care and staff morale as well. And it's not to say that both homes haven't undergone basically everything we can think of at this point with regard to recruiting and retention, job fairs, job out, living classroom, just a variety of undertakings basically to maintain our staffing or increase our staffing. So, I mean, that we continue to have challenges here and there. I think things are improving. We've got more recently at the lodge, we're in the midst of recruiting hopefully another 4 PSWs in a very short order. Things are picking up that way. But if I could, I know that there's a keen awareness with regard to the unionized staff, but there's also, management has also been affected throughout these past 20 months as well. And as is understood and expected, management staff routinely work through beyond their regular hours. But again, these 20 months have pushed beyond that which has been typical. I mean, just all the COVID type things that didn't exist previously, like screener recruitment, wrangling and inventorying personal protective equipment, daily communications with stakeholders, security administering, numerous IPAC directives, funds, each with, it's all wonderful. It's great that we're getting the funding that we need, and certainly the directives are very important with regard to keeping everybody safe. But it is rather taxing keeping track of it all, and it has had a bit of an effect. Well, it has had a bit of an effect. I think a profound effect. So in doing so, like several managers have exceeded their hours of work, typically compensated by corporate policy or very early in the year, and continue to do so. Often coming into work as frontline staff, whether it be in the kitchen or working as an RN, a nurse manager on a night shift, and responding to several, various concerns after hours. I know as managers we're always, available as it were, but I mean, truly this has been the case, and certainly over the course of the outbreak at the lodge, and the 7-day a week was not hyperbole. It was for a number of months the case. Anyhow, and I'm sorry, my intention here is not to cry a river, as it were, but just I think that it's important for the elected to have a picture of what's been endured and what continues to be the case. And we're seeing some improvement, certainly at the manor. The management team has they're approaching a full complement, having been down a number of key positions only months ago. And at the lodge, we're kind of on the opposite spectrum right now, where we were kind of full. We're more recently challenged with some key vacancies. As it stands now, will be, I know in the report says 3, but it's going to be 4 within the next month, vacant management positions, 1 on a permanent basis to replace the permanent position, and 3 anticipated as extended temporary periods. So yeah, again, just for awareness.
If I might, Mr. Blackmore, I think as we had done with the emergency services report, before we get into the resolutions, perhaps we will go back to information items for review, and then we will pick it up again for the resolutions upon review. With that, committee, any questions, comments on item 1, the manor resident statistics? Warden Robinson.
Thank you very much, Chair. I was just looking at the numbers, and maybe these numbers have been in front of my face many times, and as any kind of statistics, sometimes we just glance over them and move on. But I look at the number of men compared to women in both the manor and the lodge. There's a difference of 31 at the manor and 51 at the lodge, with women the most populous. So what I'm wondering is, does that provide us with a challenge as far as suitable rooms for these individuals? And I'm wondering, do we have men and women sharing a same room, and is that a choice, or is that out of necessity?
Through you, Chair, to Warden Robinson. Yeah, I mean, it's certainly been the case. This has been the trend for a very long time, that there tends to be more women residents. Certainly, we don't we don't mix male, female residents in a given ward or room. I could see where it may be a bit of a barrier if by way of having to share a basic room, and it happens to be a male basic room that's open with more female applicants, it could slow the process. I think it may become more of a factor at the manor versus the lodge, where the lodge has 100 private rooms and 66 shared rooms, and certainly at the manor they have still have some more basics.
A follow-up, Warden Robinson.
Thank you very much, Chair. And again, I know later on we're going to look at a resolution around looking at the viability of applying for opportunity to increase beds. So that's really where I was going when I started looking at this and looking at the report as a whole, where there might be, some need, not, that whether or not adding rooms will actually allow us to serve more people, or just to serve the people that we have now with more choice and options. So thank you.
Thank you once again, Warden Robinson. I'm expect that, sorry, that's probably inappropriate. I'm curious if this might be more incremental than a larger issue. When I'm looking at these statistics, actually, historically, it seems that Miramishi is more in line with what the historic trends have been than the manor, actually. The manor appears to me to be an outlier. Typically, for some years now, generally speaking, it has been 1/3 to 2/3 when I've reviewed these reports. I'm assuming that trend line probably exists across the province, perhaps across the long-term care sector, if you will, at which point I think that probably intake has gotten to recognize the typical distribution of residents. Anything further on either of the manor or the lodge statistics? Anything on the waitlist information? Item 4, the pandemic update. Warden Robinson.
Thank you, Chair. And I was kind of slow. I want to go back to number 3, the wait list. I just wanted to know, so I know there's as of September, there was 250 at Bonnish Manor and 377 on the wait list for, for the lodge. What is the criteria of getting your name on the list? Do you have to be, at a certain stage of needing support, or, once you turn a certain age, you get your name on the list and hope that when time comes that you need it, that your name has moved up? I'm just curious. As bottom line is, are these real numbers of people who today, if we had the beds, would enter long-term care?
Just before I go to you, Mr. Blackmore, because I did have some personal experience in this regard, the assessment for potential residency at long-term care has been performed by the LHIN for a number of years. It was the Community Care Access Center, which got sprung out. Then it got returned to the LHIN. And as I understood there, once having been assessed as meeting that threshold, the criteria for residency at long-term care, each individual then designates their I think that there's more than one, but I think they are in preferential order. But having said that, Mr. Blackmore.
Mr. Chair, that's correct. There are various levels of need, with the top being that of crisis. And essentially, as Warden Robinson alluded to, there's a level of care it must be required, and the person has to be 18 years or older. And aside from that, it really speaks to the acuity levels required for the individual as to where they're going to be placed on the list. So in looking at the list, it's not to say that any one of these residents would necessarily come into the home as of, if a bed were to be announced to them, but recognizing if they were to turn that bed down, there is a possibility that they get moved lower in the list.
Follow up, Warden Roberts.
Thank you very much. The whole reason for me asking the question again is to try to get a sense of what the real need is for long-term beds in the county and in both of our facilities. Like if as a miracle tomorrow we had another 377 beds added to the lodge, would we have 377 people who are on the list wanting to move in the next day? That's where I'm trying to go with this, because I'm not sure. I'm not sure if these numbers are actually real need or potential future need.
I do. So I have been somewhat following this, though intermittently and randomly, as opposed to each month. But it does seem, I know in the past at a committee meeting, I had noted that the wait list was indicative of 3 people waiting for every bed that was available in across the county of Renfrew, whether municipal, not-for-profit, or for-profit. Given the substantial investment from the province of Ontario at several of our long-term care homes, and most recently, of course, in Deep River, that has, when those beds come online, it is going to change the dynamic somewhat, but that is an astonishing wait list of 3 people waiting for each individual bed. This is long-term care, which itself has become somewhat of a misnomer. I think the average residency in long-term care has been shortening substantially, ever increasingly over the years. That these are people who are certainly in need. That is certainly one of the elements that drove the community paramedicine long-term care at home. But I don't know if you wish to add anything more, Mr. Blackmore.
No, Chair, just if I could, I mentioned that the potential to lose a bed if you decided to, or sort of lose your turn, as it were, or your place in line. That is currently suspended during this COVID pandemic.
Thank you for that clarification. Much appreciated, Mr. Blackmore. Anything further on item 3, Mr. Morrow?
Thank you, Chair. And a very interesting debate in terms of where we apply limited financial resources to supporting members of our community in need. And I just want to bring to or remind committee the fact that we have a community paramedicine long-term care program who is looking at those same folks on the wait list and trying to keep them or pull them from the wait list to make sure that we can continue to support them at home. So the warden raises a good point in terms of now we have this particular program in place. So it's, at some point we're going to need to assess and see what the implications of that program are as it relates to the need for more beds down the road. So I think I understand where the warden is going with her comments. I'm not sure we're there yet. I'm not sure that given growing demographics and as our communities continue to grow, that, are we going to always need more long-term care beds? I think that's a question that seems to come to mind for me, but I did want to remind committee of the virtual the long-term care program where Chief Nolan and his staff are doing their best to keep people out of long-term care that are currently on that wait list. So I'll leave it at that, Chair. Thank you.
Thank you, Mr. Morrow. Perhaps to also add a little bit into the debate, ever is a long time. No, not ever, I would suggest, but the particular demographic, the particular generation that has been the boomers have disrupted, affected, impacted at every sector. We built a lot of schools and then found schools empty, and then we are having the bounce and we are finding the impacts of that. I would remind committee, I do not recall, several years now have passed since Mr. Eric Hanna made a delegation to Health Committee ages ago when we were still meeting in person, wherein recognized the province's commitment towards 15,000 new beds, potentially 15,000 or more on top of that, and hit in Mr. Hanna's comments then with respect to the looming demographic tidal wave that was coming, that was still not going to be sufficient. Will all of those beds be needed down the road? No, I dare say they will not, much like the schools ebbed and flowed, so too will long-term care. And I think some careful consideration has to be given into what sort of future that institutional long-term care. The other element, as everyone is critically aware, is the acuity of the folks coming into long-term care, and certainly enormously pleased at the standing up of the community paramedic long-term care at home. But these are challenges that are not going to be fully addressed, and there is going to be a need moving forward. And now is the time to begin that conversation of what our future needs are going to be. Anything further with respect to the wait list? Councillor Doncaster.
Yeah, thank you, Mr. Chair. I just wanted to make a comment with respect to beds, and we know that the province funds long-term care beds in this province. We're not alone, but the county of Renfrew chooses to fund our long-term care beds at a higher rate than that, to the tune of $1 million for each of the facilities that we run. We acknowledge that the Aging at Home program, Flex program, community paramedicine is a really good program, and it's also while it may not serve every person's needs, it is certainly a more cost-effective way of providing a level of care. As I mentioned, it may not be for everybody, but I think we need to be cautious at looking at more municipal long-term care beds and the costs associated with them. And I go right back to my previous comment that healthcare services in this province should be funded by the province and should not be funded on the property taxpayers.
Thank you, Councillor Doncaster. Just as a point, certainly the County of Renfrew does supplement the provincial financing. However, keep in mind that we are also, I think, through the Long-Term Care Homes Act, those southern Ontario upper tier municipalities are required, whether of their own volition or whether they contract for that service, but we are mandated that we must provide Long-Term Care Homes Act. I don't know, Mr. Morrow or Mr. Blackmore, if you can add any precision to that, if I'm way off base on that.
No, you're absolutely not, sir. That's the act specifies that we're required as a county to have at least one long-term care home and make sure those beds are available to our community.
Okay, thank you. It is, I do appreciate all of the comments and questions. I think we are going to increasingly, as we move forward, having more and more of these conversations. This critical need is not going to disappear. Anyway, anything further? Okay, thank you. Moving on to item 4 then, the COVID pandemic update from long-term care. I see none. There was, I certainly have to bring forward, in particular, the final paragraph in Mr. Blackmore's report on Community Health Ontario and the amalgam of agencies that are constitute Community Health Ontario, and I'm firmly behind this initiative. So I have to say it was enormously disappointing, concerning last week when the Premier announced that the province was not going to mandate vaccines in the healthcare sector. This was part of the conversation when back in August, when vaccine mandates were actually beginning to be rolled out, was the portability of a lot of the positions within long-term care. Within this report, at numerous places, thematically, it seems consistent of the health and human resource challenges that we've had in long-term care certainly forever in terms of my participating in the county of Renfrew. So enormously disconcerting that the province did not see fit to support those sectors, the Ontario Hospital Association as well. Most of the hospitals across the province of Ontario. Very disappointing and disconcerting that the Premier and the province did not see fit to stand behind the health sector with respect to the vaccine mandates in response to what is, subsequent to me saying it earlier, we're now just back, as of today's report, just under 500 on the 7-day rolling average of 500 cases per day, up from 350 not 2 weeks ago. So once again, COVID is suggesting that we have taken our eye off the puck. In any event, that is my rant, I guess, on item number 4. Councillor Emo.
I agree with your comments, and I think it behooves us to request that committee consider the advising the warden to write a letter on our behalf to the Premier and to Minister Elliott, expressing our disappointment. I think the Premier correctly has within his caucus address the issue of vaccination, and I recognize the pressure that the Premier and Minister Elliott are under to manage all of the affairs of the province, but as a significant employer and a significant employer at arm's reach within the health sector, I think they should reconsider, and I would encourage the County of Renfrew to support a motion to have the warden write a letter to Premier Ford and to Minister Elliott requesting that they revisit this issue and proceed with issuing statements regarding a mandate for people to be vaccinated, with the usual exceptions around health and the other issues that might occur. But as a responsible employer, I think they need to revisit this. Thank you.
Councillor Emo, are you moving that direction?
Yes, I am.
Okay. Mr. Morrow.
Thank you, Chair. Just for clarification, and my advice to committee would be that this would be a recommendation to County Council in that it is a position of council on a particular issue, therefore should be endorsed by County Council.
As always, I bow to greater knowledge.
And I just make that point up to you, sir.
So I think that taking that into consideration, Mr. Morrow, I think that would be appropriate. Certainly the Health Committee is tasked specifically in our terms of reference in this regard, but I think from a higher level and the response to COVID more broadly, that is, I'd certainly take that into advisement, and perhaps that resolution then would be, Mr. Emo, at your, Councillor Emo rather, at your discretion, that the resolution be that it be recommended that council direct the warden on corresponding with the Premier, urging a reconsideration.
Yes, that's perfect. Thank you.
Okay, thank you. Can I have a seconder for that motion, please? Councillor Love. Just before, and I'll certainly open it to conversation, just Ms. Hill, do you have the gist, if you will, of Councillor Emo's resolution?
Yes, Mr. Chair, I have the gist of it, but it'll need a little fine tuning.
Okay. I think that it is understood, Mr. Morrow, what the intent of that resolution. I do not think that we need to wordsmith that today. Thank you, Ms. Hill. With that, committee, any further question, comment? Seeing none, all in favor? That is carried. Thank you. Anything further more broadly on item number 4? Moving on to, sorry, Councillor Murphy.
Can you not see me?
I'm sorry, I'm going to have to move you more to the center of the screen. An appropriate place, I think, for a past warden.
Yeah, put me in the center then. So a couple of things. The positivity rate today, well, we were at 441 cases today. The more alarming thing for me is that we're back up to 3.1% positivity as of today. So that's a bit concerning. But Mr. Blackmore, procedurally, since the province isn't mandating, what will happen with these 20 employees as of Monday?
If I might, I'll take a stab at that, Mr. Blackmore, just before, and I will certainly seek your input as well. It is important, I believe, to underscore, and I stand to be corrected, this would be portable for any staffer that would have portable skills to move to another sector. It is my understanding that I think within the healthcare sector in the county of Renfrew, there has been a fairly universal uptake with respect to a vaccine mandate, which is similar to the position of the county of Renfrew, such that if it were to be portable, I think it would be required to be portable right out of the county of Renfrew, though I'm uncertain if that is across each of the healthcare entities in the county. Mr. Blackmore, perhaps you can shed some light on that.
Through you, Chair. Yes, just with regard to the portable, so long-term care, the ability to work in another long-term care home is off the table because this is mandated throughout long-term care throughout the province. And locally, as has been the case for both homes, quite early on, we undertook to make it a condition of hire that you be vaccinated, with many other health care agencies have done the same. So I'm thinking there'd be, well, little opportunity to work elsewhere in healthcare, at least in the immediate area.
Mr. Morrow, I see your hand raised as well.
Thank you, Chair. And just for clarification, when we're having this debate over mandatory vaccines, nothing has changed for long-term care, is my understanding. Directive 6 still applies. We are obligated under the legislation and the regulations to ensure that our staff in long-term care are fully vaccinated. Otherwise, the policies that are in place by the province apply. We have no choice but to, I was going to say lay off, but suspend them without pay is, I believe, the language of Directive 6, and that is what we will continue to do. The question at hand was the broader healthcare sector, where the Premier has made a choice not to put in place at hospitals across the province mandatory vaccines. So creating a bit of a challenge. And the question was that, could our staff that were on layoff or not fully vaccinated then move to the healthcare sector? At a local or regional level, our hospitals are all demanding mandatory vaccines of their employees. However, again, not mandated by regulation across the province. That is the distinction and the concern, I believe, that we're facing in the province of Ontario. Thank you, Chair.
Thank you, Mr. Morrow, to you and to Mr. Blackmore for providing that clarity that mandate does exist within long-term care. It has not existed within certainly the hospital sector, and that would be the concern. As I indicated, health and human resources staffing has been a challenge in long-term care for a number of years, that this opened the door for that. But you did also confirm that within the county of Renfrew, there is consistency in the hospital sector as well. Councillor Murphy, you follow up.
Thank you. So even more important than, I believe, for County Council to endorse a letter from the warden to the Premier and Minister Elliott, how do you reconcile that long-term care has to be vaccinated, paramedics have to be vaccinated, but hospitals don't? That the confusion in that alone, I think we're going to see lawsuits come out of this. There's going to be a fallout because of the confusion that the province is sending us. So I guess my question was, I guess it's been answered, but would those 20 employees fall under our global policy in Renfrew County that would make them have to get a rapid test once a week. And so I can see Paul's shaking his head no, so I will leave it at that. Thank you.
Thank you for that. And thank you, Mr. Morrow, for expediting the meeting also. Anything further on item 4? Okay, thank you. That was a very robust debate. Item 5, the new Long-Term Care Act, fixing long-term care. As I'd indicated, there are a number of these next, a series of these next elements that all I think are part and parcel of the same theme, which is there have been long-standing issues within long-term care. So inordinately pleased that this is commencing. You'll note certainly in the funding as we get to that, that it is going to accelerate over each of the next 3 years as well. This is something that cannot be, a switch cannot be flipped and make it so. It is going to take some time, but many of these next 5 or 6 numbered items, I think thematically could all be part and parcel of the same thing of making long-term care home what actually Shirley Sharkey identified in 2006 it should be. So we'll file this under better late than never. Moving on to item number 6, the new inspection program. Item 7, the further extension of the PSW wage enhancement. Item 8, investments to increase direct care time for residents. Item 9, free training funds skills, Advanced Ontario. Item 10, additional training for long-term care nurses and personal support workers. Item 11, the Treasurer's report. Item 12, the Ministry of Long-Term Care inspection report. I just wish to point out, committee has unfortunately received these. The aspiration is to not receive these, though that is in theory, not in practice. It is certainly worth noting that the critical incidents that drove these inspections, these are self-reported. There are 2 means whereby the province would initiate an investigation of this sort. One is a complaint driven by residents or family. The other is self-reporting. In each of these instances, this was self-reporting by Mr. Blackmore and by the long-term care. Item 13, the surplus reallocation. Item 14, the administration clerk for the Meals on Wheels. Item 15, the long-term care homes health and human resources status. Mr. Morrow.
Thank you, Chair. Through you to committee, I just wanted to acknowledge Mike and his team. This item is in the report for information, but committee should be aware, and I will be bringing this to council down the road. This is not the only department where this particular issue exists. It is a circumstance of our policy as it relates to overtime, and as committee is aware and county council is aware, I've brought that back to committee for review in the past and made some changes. I think with our new HR team and staff having a bit of a new look at this, I will be bringing something back to FNA and county council in the new year to address some long-standing issues as it relates to our non-union staff and our management team, because what Mike is seeing here is also occurring in emergency services and to some degree in public works. And the challenge here is that the non-union staff have more flexibility, and our management team, and they're often required to fill in when our unionized folks don't show up for shifts or are unavailable. And quite often what we're seeing is the policy provisions do not support compensation. So, this is a unique situation with COVID. We have had far more staff off on stress leave in numerous departments and related health issues. And it's been more challenging to manage. So hats off to our non-union staff and our management staff who have always stepped up to make sure our residents are cared for. And in some cases are doing it and are not compensated for it in any way. So I did want to let committee know that this is on my radar screen to bring forward for a conversation to finance and admin in the new year. Thank you, Chair. Appreciate the opportunity.
Thank you, Mr. Morrow. I think it's important also to underscore Mr. Blackmore's own comments that this is not the exclusive domain or jurisdiction within long-term care, but I think it is also very valuable that committee be apprised of this. Too often, when things appear to be, or if things don't appear to be flying off the rails, there is perhaps an expectation that things are normal. It has taken an enormous effort to be able to present the appearance of normal. It is akin to the adage of the duck. There is serenity above the surface, but there is paddling like hell below the surface. And I know that that's happened within long-term care, absolutely, and across the other departments of the County of Renfrew, and even more broadly, those of us on this meeting itself recognize within each of ourselves, plus minus, the disruption that we have been dealing with. So this is writ large, certainly on the public facing and parts of the County of Renfrew. So I think it is extremely important that committee and ultimately council become made aware of the enormous effort. I'm sure it's in the back of our minds, but this makes it a front of mind issue. So thank you, Mr. Blackmore. Warden Robinson.
Thank you very much, Chair. And I want to thank Mr. Morrow for making those comments, because when I was reading number 15 and I highlighted some of the wording, and in particular, when he talks about we've pushed managers beyond the typical expectations. Yes, Mr. Blackmore brought it to us as information, but it's information that we can't ignore, and we can't just say thanks and move on to item number 16. I think that this is, this is a message to us. I think that we need to do something about it sooner rather than later. What we can't do is we have some incredible staff and management, and what we can't do is expect them to continue to deal with this issue and just pat them on the back and say, thanks very much, keep on going. So thank you, Mr. Blackmore, for bringing it to our attention. Thank you, Mr. Morrow, for telling us that we're going to be doing something about it, and a recommendation will be coming forward, hopefully very close to the new year, to this committee and to County Council.
Thank you. Anything further on item 15? With that, sorry. Yeah, I was just about to, Mr. Blackmore, yield. Actually, if you had comments on 15, that's fine. If you do, or if you don't, from that, if you would go directly from that into the resolutions.
Just if I could on 15, I think one thing I was remiss from our report is that the efforts, there are also many efforts underway to show appreciation for the work that staff and management have done over the course of the pandemic as well. A variety of appreciation events and those types of things. And I thought it was important that given the circumstance, that not be left out.
Thank you.
And if I could, for resolutions, number 16. New long-term care beds, strategic plan goal number 2. So as a background, the government recently announced a commitment to create another 30,000 long-term care beds by 2028, in addition to redeveloping older beds. So as it pertains to our local, our area, committee will recall that the Ontario government back in 2020 announced an investment of $17,833,000 to build 71 new and 281 upgrades to long-term care in Renfrew County. And this saw Marion Hill with 29 new and 131 bed upgrades, the Grove Nursing Home in Empire, with 36 new and 60 bed upgrades, and the Valley Manor Nursing Home creating 6 new and 90 upgrades to their existing beds. And certainly more recently, as you will recall from the presentation given by Ms. Hodson to council regarding the Deep River District Hospital Four Seasons Lodge build, that equates to basically replacing their current 14 beds with 96 beds in a new home slated for development. So it begs the question with the announcements, are we in a position, or is this something that the county wishes to pursue, i.e. the creation of additional long-term care beds? And that's the back. Sorry, if I could. Go ahead.
No, apologies, Mr. Blackmore. Appreciate that. I'm going to read the resolution and seek a mover and seconder, please. That staff be directed to explore the viability of the construction of new long-term care beds at Bonashare Manor and Miramishi Lodge properties. Can I have a mover, please? Councillor Murphy, seconded by Councillor Grills. Discussion. I'll wade in a little bit. Certainly this discussion, this government's commitment towards both the new beds and the redevelopment of beds across the province sparked a conversation, I'm going to suggest perhaps 2 years ago, that ultimately was the impetus that developed the seniors housing strategy. To recognize that, as Councillor Doncaster has certainly noted, we are not going to be able to meet this tidal wave of retirements and increasing needs from the demographics. From that, sprung the seniors housing strategy as the starting point. I think that has been an exceptional enterprise and has yielded a fantastic document to guide us forward. At the same time, part of the discussion at that point was, when the province is funding the expansion, that is the time, if you need to expand, to make your case for such expansion. At this point, the resolution is clear. It is not suggesting an expansion, but towards exploring the viability of an expansion of the municipal beds in the county of Renfrew. So I think that this is the logical next step in having developed the seniors housing strategy, to also recognize that is also not going to be the panacea for the looming need. Anything further? Warden Robinson.
Thank you very much, Chair. I noticed it talks about new long-term care beds, and I was wondering whether or not we would be looking at some, not just new, but some upgrades on their old. I believe that the manor probably requires that. I see Mr. Blackmore shaking his head, yes. And when we talk about explore the viability, does the viability, and I have to pull up my dictionary to see, does that also include the need? Because again, you referenced our seniors housing strategy. And again, I talked about the people sitting on the wait list. I'm really hoping if we were to consider going forward and looking for actual additional beds in either of our facilities, that we're really taking a close look at that wait list and what the real need is as far as long-term care beds are concerned. There's certainly, we've seen through the survey and many discussions over the last few years that what is really needed and I think desired here is transitional housing and supportive living options as well. And again, I mean, we have the community paramedics for long-term care. That's funding that Chief Nolan indicated that project and program will be reviewed in 2 years. There's only so much money to go around. And I see extreme value in being able to assist people to stay at home if that is their choice, and to be able to stay home and live with dignity and safely. So I'm just conscious of I think we have to sort of pick and choose what we want to see happen as far as long-term care is concerned in the county of Renfrew. Thank you.
Thank you. I see Councillor Emo, but I'm just going to wait. I think perhaps it's in relation to the warden's comments. Mr. Morrow.
Thank you, Chair, and you're correct. It is within with respect to the warden's comments, and it is no reflection on the fact that I have a performance review coming up as well. But the warden is absolutely correct, and I think the biggest gap that she has stated is that the gap that we're not talking about is the transitional housing. You know, we want to most certainly, our top priority is to keep our seniors in their homes and support them. We have long-term care facilities, but it's what's in between where they need assistance and a greater level of care that maybe they can't be in their home, but maybe through a public-private partnership in some type of facility, we can support them in terms of transitional supports and housing. And I think that's the gap we're missing. And I think that is the gap the province is missing in providing us with financial dollars as well. So when the warden talks about viability, I would hope that all those things would be on the table when we bring it back to council in terms of assessing need and what is the best bang for the buck in supporting our seniors in our community. Thank you, Chair.
Thank you, Mr. Morrow. I am certainly of a mind with the warden and with the comments that you have made in support. And I think that that is going to require a concerted effort in engaging the province. What I would caution is that right now the province is saying these are envelopes that we are going to provide to expand and renovate beds within long-term care, that when they are providing that, that is the easiest time to access those. So to not lose sight of that. Just before actually, Councillor Emo, I go to you. The other thing I wanted to raise, I didn't raise it, but I wish to speak to the warden had raised with respect to the redevelopment. Certainly as in the first and perhaps second waves, as COVID was doing significant damage and visiting trauma within the long-term care sector broadly, the debate seemed to have opened with respect to for-profit and not for-profit. Don't wish to wade into that conversation at all. But I know one of the past deputy ministers of health, Dr. Bob Bell, certainly provided much data that the Venn diagram was described much more of a circle when it was a discussion of the type of residents, i.e. wards, were much more heavily impacted by COVID than private and semi-private rooms. So I think that is certainly, as the warden has raised, I think that those are significant opportunity to examine the structure of the residences within both long-term care and to meet those needs on a going forward basis. Mr. Blackmore, or sorry, Councillor Emo, you had a question.
Thank you. I'm just curious, when we're undertaking the, I'll call it the study for the lack of a better word, the viability, exploring the viability. I'm hoping that we will take a look at some data from the hospital sector. I'm wondering how many beds over a year get slowed in emptying because people aren't high enough on the wait list or have to find a way onto the wait list and move immediately to one of the two long-term care homes. As well, if we could take a look at RCHC, Renfrew County Housing Corporation. I think I remember some of their waiting lists talk about seniors. And then also I think some of our homes have by natural progression become a little older, with the average age of the residents. And then if there's a means of capturing how many people are hurried into our long-term care homes and would have been better served with staying in some kind of transition housing. So I think it's not going to be as simple as identifying how much drywall to put up. I think there's some impacts across the services that we fund directly and some of the services that we benefit from our partnerships with. So I'm hoping that we take our time and take a look at the whole system as best we can. Thank you.
Thank you, Councillor Emo. I certainly think that it's important to bring forward that ALC, or alternate level of care, is something that has been impacting the broader health system for a number of years. It is certainly underlying one of the main drivers of this provincial government with respect to reorganizing care in the province of Ontario. But there is also alternate level of care within long-term care. I don't know what the level of that is. Typically, when you hear the term ALC, or alternate level of care, those are people that are in hospitals that require a higher level of care, but that there is no room within the long-term care sector. So all of these are broader questions. Once again, I'm certainly recognizing that there is a continuum, and that we need to address the looming demographic pressure through that lens of the continuum, but not to lose sight of, in my estimation, the need to move with some alacrity at the time when the province is funding expansion to long-term care beds, to certainly examine critically what the need may be, and if that need is showing a requirement, that this is the time to make application and not to miss an opportunity in looking at the broader scope. Warden Robinson.
Thank you very much, Chair. And just in reference to Councillor Emo, most of this committee will hear this or see the statistics already, but for our housing corporation, there's 152 seniors right now on the wait list. Again, though, I don't know what the criteria is to get your name on that list. It may be something where you anticipate needing, and you know it's a 2, 3, 4 year wait that you put your name on early and hope you bump up at the time that you need it. But looking just at the numbers as of today, there's 152.
Thank you, Warden Robinson. Anything further on item 16 and the resolution before us? Seeing none, all in favor? That is carried. Thank you. Mr. Blackmore, on to item 17, please.
Thank you, Chair. Number 17 is that of signing authority for Bonshire Manor. The background is that Ms. Brittany Finley, Administrative Assistant Finance, is returning from a 1-year leave of absence December 4, 2021, which concludes the contract of Ms. Kim Prentice. And on behalf of the Bonshire Manor staff, we thank Ms. Prentice for her dedication and position, and for the position and duration of the contract. So essentially, we're looking for a revision of signing authorities.
All right, thank you, Mr. Blackmore. Once again, committee, I'll read the recommendation that the signing authority for Bonshire Manor trust accounts be updated to remove Kim Prentice and add Brittany Finley, effective December 4th, 2021. And further, that 2 of the following 4 names have signing authority: Jeffrey Foss, Kimberly Saunders, Sandra Block, and Brittany Finley. Can I have a mover, please? Councillor Love, second, Warden Robinson. Discussion? Seeing none, all in favor? That is carried. Thank you. With that, we are at 11:30. I'm feeling somewhat bio-driven right now. Can we take a 10-minute break by committee's discretion?
Chair, you need a mover and seconder for the report as a whole.
You are correct. Thank you, Councillor Murphy. Can I have such a motion to accept the long-term care report? Councillor Emo, second, Councillor Doncaster. All in favor? That is carried. Thank you. And we will reconvene here sharp at 11:40. Welcome back, everyone. We will immediately move to the final report for this morning. Mr. Morrow, I will yield the floor to you for the administration report, please.
Thank you, Chair. Through you to committee. There is one item in the administration report, and that is the response from the Renfrew County and District Health Unit to the warden's letter of September 7th. And in that letter, essentially the chair of the Renfrew County and District Health Unit thanks the warden for her letter and does acknowledge a willingness to work more collaboratively and to discuss coordinated communications with the County of Renfrew. So that letter is attached. I did also include the minutes of the conversation from the Renfrew County and District Health Unit that were available at the time on the website. It was brought to my attention from the chair that the minutes that we did provide were not the most recent ones or approved. They were just sent out this morning. And I believe they were also sent out to Finance and Admin as well. Thank you, Chair. That is the administration report.
Thank you, Mr. Excuse me. Thank you, Mr. Morrow. You are correct. In speaking with the chair of the Board of Health, it was inadvertent that it was a draft, an early draft actually of the minutes of the September 28th meeting that were posted on the website. That has been updated as of just yesterday. And the accurate minutes of that September 28th meeting are now on that website, and that was what Mr. Morrow had arranged to have sent to each of Health Committee and Finance Administration Committee. So I much appreciate that, Mr. Morrow, you're stepping forward on very short notice. With that, then on Mr. Morrow's short report with respect to the response from the health unit or the minutes. Any questions or comments? I see none. Can I have a motion, please, to accept the administration report, please? Councillor Love, seconded by Councillor Emo. Once more, finally, any discussion? Seeing none, all in favor? That is carried. Thank you. With that, just bear with me one moment as I return to my agenda. Is there any new business? Seeing none. Mr. Morrow, there was no closed meeting at the time of the distribution of today's agenda report. Has that changed?
No, sir, it has not.
Thank you. With that, then we are at adjournment. This being November, the committees will, none of the committees will meet in December. There will only be, of course, the single council meeting that is the inaugural meeting, at which point the warden that should be appointed, elected at that time, shall reconvene the striking committee to design the committees for the ensuing year. So we do not have a next meeting at this point. I would invite a motion to adjourn, please. Councillor Emo, seconded by Councillor Murphy. All in favor? That is carried. Thank you. And thank you, everyone, for a very expedited and yet a very engaged debate on several items today. I thought that that was very valuable for the committee and perhaps those who may have been tuning in at home. With that, Mr. Benke, are we